Mission and Margin is the business of healthcare. I'm your host, Matthew Hannes, founder and executive producer of the business of healthcare. Behavioral health and other social determinants impact healthcare spending and clinical outcomes. Integrating meaningful patient information into social service agency and medical provider workflows may improve quality of life and total medical spend. A physician knowing a patient presenting with severe pain in the ED is being treated by a nearby drug rehab agency for substance abuse disorder leads to faster triage and more appropriate treatment. Applying this and cross-pollinating these data is a big challenge.
One of the people we served who had, the year before we got involved, you're going to think I'm making this number up, had 115 emergency room presentations in the year before the Integrated Care Project. None subsequent, none. But 115, many of those leading to acute care hospitalizations. Because it wasn't that he wasn't sick, he was very sick, but he was just skipping over the system and then touching briefly in the emergency room, getting one issue or another. Goes back to what you were saying, complex presentation. Get a complex set of solutions built around him. He's not going to the ER. He's not going to the ER because he's not as sick anymore. Yeah. Who wins in that?
Yeah.
Everybody does.
I view Foothold as being a node in this coordination of care platform that I think we need to implement everywhere if we expect to have an efficient and effective healthcare system, right? So if I'm a clinician at a mental health organization, what about the fact that my client went to the ER 2 weeks ago is important to me? It's not just the bare fact that she went there. What happened there? And even that may not be relevant to me, but where in my workflow is that happening so that I can bring these pieces together while I'm trying to provide care to this client?
We're joined by two business leaders solving the integration of social determinants data across providers. David Guth is Chief Executive Officer and co-founder of Centerstone, one of the nation's largest behavioral healthcare providers serving over 180,000 individuals annually. Guth is also a not-for-profit merger expert, 19 of which he has led. Marlo Greenberg is founder and Chief Executive Officer of Foothold Technology. Social service agencies utilize Foothold's workflow and electronic health record tools to stitch together data fragments from medical and social service providers, giving a more holistic patient view to both. This interview was made possible by New Directions Behavioral Health, Raven Healthcare, Foothold Technology, and VPAC Clinical. To watch, listen, or read the full interview, visit bohseries.com or search for the words Business of Healthcare and our red logo wherever you listen to podcasts.